important thing. God bless.
So let's set the stage. Put it in perspective, 2 weeks ago, as President Trump alluded, a leading U.S. drug manufacturer came into this room and agreed to do something none of us thought was possible, a most favored nation agreement with numbers, again, inconceivable. Last week, a company from Europe, a global leader in the pharmaceutical sector, came to this office, made the same kind of commitment for most favored nation pricing, again, because the president insisted on it and was persistent, and he alluded to the fact that he was calling Secretary Kennedy and me quite a bit. He definitely was, with great insights into the process and would not hold back. But I think what you're seeing today is something even larger. It's larger because we're now showing that MFN is a tool that can get other initiatives going as well. We are revealing perhaps the most important MFN opportunity at all because it's about procreation. It's about babies. It turns out that MFN is a tool for a lot of things, and it goes without saying that you get the drug pricing down, but lots of other business necessities become possible when that occurs. So Secretary Kennedy and I, who's a wonderful leader, talk frequently about family. I think the reason he's a great leader, and president as well, is because they have large families and they take pride in the joy that it gives us. But many families, as Senator Britt alluded, do not have the ability to have children. But it turns out that it's about 1 in 3 families, a much higher number, that don't have the number of babies they desire. They're under-babied. So this president committed to address that during the campaign, and he is delivering on that today in a way I don't think anyone thought was possible. We are opening the door with MFN pricing and tariffs that support it, Secretary Lutnick, with a new approach to make reproductive medicine more affordable for Americans. Now, I know what you're all thinking, and you're probably right. There are going to be a lot of Trump babies. I think that's probably a good thing. But it turns out the fundamental creative force in society is about making babies. It's about creating. And this country, the one that President Trump is leading so beautifully, has been a country of abundance, not scarcity. To have abundance, you have to address the fact that we had 3.6 million babies last year, which is beautiful, 3.6 million miracles. That's 500,000 less babies than we would ideally have had, even to replace our current population. Building on the success of the last 2 weeks, our team, led by the head of Medicare, Chris Klump, who's standing over there, and Ina Hernandez, have negotiated a spectacular MFN deal to reduce the cost of IVF drug prices by $2,200 a cycle. That's nearly half of the price that it had been. The most prescribed drug in this category in America, made by EMD Serono, is described over here. And you'll notice, President Trump, these are discounted from $242 to $10. I don't know what the math is on that. We can't even calculate it. It's a lot. It's too high to calculate without a more studied approach. But I give it up there because that number of $10 will apply for every American who earns less than $115,000 a year. That's 70% of the American people. The remaining folks who are able to make more will have to pay a tiny bit more, but it's still most favored nation pricing, no different from what the Europeans are willing to pay. Now, to make this deal happen, Chris and Inma had to do something special. They have to actually not just get the drug price down, but get the middlemen to let it go as well. And, Mr. President, we've met with the middlemen in the past. They're now joining the MFN movement. I want to thank Express Scripts Freedom Pharmacy and then CVS's Specialty Pharmacy because they were willing to stand up and do the right thing for the American people by answering the president's call and slashing their prices. Now, this announcement also encompasses a remarkable move from Marty Makary. And Marty Makary is, of course, the leader of the FDA, but he has ongoing efforts to accelerate their approval of innovative medicines that will further reduce the price and make this whole process more seamless for the American people. Now, you're about to hear about a spectacular new program that's been alluded to. But one of the architects of that program, Heidi Overton, Deputy Director of the White House Domestic Policy Council, is going to take us through the exciting details of what this is going to offer for the American people, especially those who are in the workforce. But first, we think you should hear from Libby Horne. Libby's EMD Serono's head of fertility. She brings both professional expertise and a personal connection to this work. She has 3 beautiful daughters, and she has personally benefited from reproductive medicine that has shaped her family. And her company made today's spectacular MFN pricing possible. Libby.
Thank you, Dr. Oz. Thank you, Mr. President.